Hi, my name is Monica Webb and I'm the Director for GatorWell Health Promotion Services. When working in the Division of Student Affairs, it's important to note that we are often the first group who communicate care and concern to our students. This means that we may become aware of situations filled with tense emotions running high. As division staff, regardless of our role or position, it is important to step in and help diffuse these types of situations. This involves skills related to bystander intervention and de-escalation. As student affairs staff, we are expected to be active bystanders. What does that mean? An active bystander is someone who witnesses a situation and takes steps to speak up or to step in to prevent escalation. Or they may also disrupt a problematic situation in general. So somehow taking control of the situation. How do you know if a situation is getting out of hand? Well, there's a few cues to look out for. For example, if someone is causing a scene, if they're shouting, if they're getting really loud. You can also pay attention to tense body language. Is the person clenching their fists? Do they look angry? You can also consider things like erratic behavior. Is someone acting abnormally? Perhaps they're under the influence of drugs. Or, quite frankly, sometimes it's just going with your gut feeling. And other times it's a lot more overt and it could involve someone asking for help directly. Realistically, we all have barriers that prevent us from intervening. It's important to be aware of these barriers. For example, there's bystander dynamics, theories associated with how bystander intervention work. The diffusion of responsibility states that the more people that are present, the less likely any one person will intervene. It's the thought that everyone believes someone else will do it. And so when you have a large group of people, most of the time everyone's looking at each other thinking, when is someone going to step in? It's important as professionals in the Division of Student Affairs that we are not making that assumption and that we are instead taking steps to intervene. Pluralistic ignorance is another example of a bystander dynamic. This is when you look at others to decide if there actually is a problem. So if no one is going to do anything, you decide it's not a problem and you don't act. Again, as representatives of the division, it is okay to be unsure of a situation. What's important is that you trust your gut and you step in. It's your professional responsibility to take action, and it's important that we do so. Other obstacles could involve peer influence. For example, you are more likely to follow what you see as norms set by your social network. It's important to recognize your influence in your professional role by intervening and considering the impact of your intervention and the impact that it will have on others within the division. In other words, you would be role modeling. There's also obstacles regarding personal intervention. These are the private thoughts and feelings that are running through us when we are faced with concerning behaviors. For example, I'm afraid and I'm not going to act because I'm afraid for my personal safety. Or the situation is becoming increasingly tense. It's okay to have these barriers. What's important is being able to identify what is holding you back so that you can make decisions based off of what is most comfortable and realistic in taking action. So once you're able to identify what your barriers are, there's 3 different ways that you can intervene. The first is direct. And this is an approach which means that you are directly interacting with the people involved in the situation, and you are directly addressing that you are concerned. It may be a confrontation. So, hey, what are you doing? Or it may just be something like checking in with a friend, asking them, are you okay? There's also the ability to delegate. So this is when you're asking someone else to help in the situation. You can use this when you are uncomfortable by saying something yourself, or if you feel like someone else is better suited to handle it. For example, if there is another staff member that is better trained in crisis situations, if there is someone else standing that you can delegate and send to go get additional support and help. Delegating is just as important of an intervention as any of the others, but it has 2 additional benefits. It makes someone else aware of what is going on and that something needs to be done. And you also provide a helping model and normalize intervening. So again, it helps communicate to others, and it's also role modeling these behaviors. Another way to intervene is to distract. And this approach's focus is diversion. If you see a situation and can think of a way to divert the attention of the people in the situation, distraction is the perfect option. Sometimes all a situation needs is to diffuse with a little diversion. Distraction may not always be an option though. For example, if there are true medical emergencies and someone's life is in danger. What's important to know with these interventions is that they don't have to happen in order or they don't have to happen together. You can even combine them though if you want to. The categories exist to help you pick out an option that works for you in order to take action. Above anything else, the importance in this is realizing what your barriers are and feeling comfortable to take action in a way that is supporting of your barriers. Keep in mind that the level of threat will also help determine your response. It's really important when you decide how to intervene that you are first and foremost prioritizing safety. So it's important to also talk about de-escalation. It may not be enough to just step in and say something. Once you have the attention of the individual, what will be important will be de-escalating the situation. And this is the reduction in the size, scope, or intensity of a conflict. This may also involve directing behavior away from the situation. So again, diverting or distracting. There's a few easy ways that you can do this. First and foremost, it's important to practice active listening. Make sure you are hearing them out. Give them your undivided attention. When they're speaking, look directly at them. Nod, acknowledge what they're saying. It's important to also show empathy. Thank them for sharing what they're saying. Most of the time, folks just want to be heard, and validating their thoughts, their feelings, and what they're saying is critically important. It's also important to monitor your own body language. Stay relaxed and calm. Keep your voice low. Do not shout. Watch your body language and pay attention to how you're holding your arms, your hands, and even your own facial expressions. Try maintaining an unbiased attitude. It's important to never argue or debate policy. Make sure you stick to the facts, but at the same time, acknowledge what they're saying and validate their emotions. Be sensitive to their feelings. It's also important to apologize when it's appropriate. An apology goes a long way, especially in a situation that is filled with high emotion. It's important to also provide options and allow for choice. It's not about who is right. It's more, again, about validating the feelings, making sure you find encouragement and that common ground. As we wrap up this training, we've got a few resources for you. The first is Green Dot Gators. This is a bystander intervention program for violence prevention here at UF. We've also listed the new Title IX website, which has great information regarding the process and campus resources. Also listed on this slide is information regarding the RESPECT team. The RESPECT team is UF's bias response group. They provide impacted parties of bias incidences opportunities to be heard and supported. They also understand and respond to situations that affect UF. They help educate and inform the community, and they create awareness regarding ignorance and intolerance. We hope you've learned to identify your barriers to intervening and have identified ways to act that are supportive of your barriers. We appreciate you continuing to communicate care and concern for our students and the Gator Nation as a whole. Thank you, and go Gators!